surpassed 200 cases of mysterious pediatric hepatitis that's stumping doctors worldwide. North Dakota's first case was reported yesterday in Grand Forks County. I spoke with doctors from all three health giants in our area to find out what we do know right now.
They get exposed to some infection and then several weeks later come down with this hepatitis. Is it something where they're eating? Is it a virus? Is it a bacteria?
The illness has, in some cases, required liver transplants and even death. But the pediatric hepatitis symptoms seem to start off common.
Many illnesses in children, the symptoms vary widely. Anything from the sniffles, upper respiratory infections. More commonly with the hepatitis, you're going to see vomiting, diarrhea, fever, fatigue, decreased appetite, and the hallmark sign of jaundice or yellowing of the skin or eyes.
It's not as though it's an illness or a condition that is purely affecting the liver, but I'm sure the children will present with a general illness and they would find that their liver enzymes are inflamed, suggesting that the liver is somehow involved with the whole disease process.
As for the case in Grand Forks County,
mild illness and completely recovered. That's the first and the most important message.
Dr. Shelton says the good thing about this is it's not common. That doesn't mean it doesn't have a chance of becoming so, though.
Well, the wonderful thing about children is that they're truly, although people don't like this word, resilient. And like a healthy child who doesn't have a lot of other terrible things, like they're an alcoholic or they have other poisonings to their liver, they can recover pretty quickly.
Sanford's Dr. Horner says cases of hepatitis in children are self-limited.
Meaning they go away all on their own. Other ways that we can support hepatitis in children is watching liver function, if we need to replace electrolytes, giving vitamin K to make sure clotting cascades are appropriate in children.
You know, adenovirus infections have been around for years.
There is thought that an adenovirus may be linked to the mysterious hepatitis. And Dr. Shelton and Dr. Aya say doctors worldwide have seen tons of adenoviruses. Like what causes a common cold?
Immunized children, and many adults now too, against hepatitis B and hepatitis A. You know, there are some others out there which are ugly too. Like there's a whole little alphabet list of things.
And in response to some saying that this disease is coming from the COVID vaccines, the experts all agree.
I have to tell you, the Pfizer vaccine and Moderna had nothing to do with adenovirus. They were not vector-based vaccines.
If you have any worries about your child and if they may have pediatric hepatitis, you're encouraged to utilize your healthcare provider's e-visits, phoning a nurse, or stopping in a clinic instead of going to the emergency room.